In the United States, an estimated 5 million people suffer from some form of gastroparesis. What is gastroparesis? Inside every stomach is a nerve that controls its muscles. If that nerve is damaged, the muscles of the stomach won't function normally, and the movement of food slows or even stops. Gastroparesis can be quite debilitating and have a significant impact on patients' lives. Symptoms include nausea, vomiting of undigested food, heartburn, an early feeling of fullness when eating, weight loss, abdominal bloating, abdominal pain, erratic blood glucose levels, lack of appetite, constipation. So, who is at risk for gastroparesis? Gastroparesis affects women at higher rates than men, and risk increases with age. Importantly, 1/3 of patients affected have diabetes. Both type 1 and type 2 diabetes can damage the nerve in the stomach if blood glucose levels are high for too long, causing the movement of food to slow or stop. Other risk factors include certain medications, particularly opioids, and previous gastrointestinal surgeries. Here is the good news. Although there is no cure for gastroparesis yet, simple lifestyle changes, along with medications, can help manage the condition. Here are some things you can do. Eat 6 small meals a day instead of 3 large meals. Drink non-carbonated liquids with meals. Chew food well. Walk or sit to help with stomach emptying. Avoid certain foods that don't digest well, like oranges and broccoli. Talk to your physician about insulin regimen changes and medications that can treat gastroparesis. Consult your physician about medications that are available and under development. To find out more about gastroparesis and treatment options, including a list of questions to ask your physician, visit www.cmeoutfitters.com/gastrohub.